Hi, everyone. It's Brad Keats from Canada Health InfoWay. I'd like to thank you for joining our webinar today. This is the third webinar of a 5-webinar series we're running on the topic of artificial intelligence in healthcare for groups that are individuals that are implementing AI, maybe for the first time. I wanted to draw your attention to a poll, hopefully that you see on your screen. We're just trying to understand a little bit about the knowledge of the audience and what your expectations are as we're going through it. You can also see that we've provided a link and a QR code for the supporting toolkit that is related to the webinars that we're running. So next slide, please. As I mentioned, this is the third of five webinars. This one is about identifying strategic opportunities, investments in artificial intelligence. So it's about strategic positioning of your AI project, understanding what the readiness of your organization might look like, some of the approaches that you might consider. Previously, we did an introduction to AI in healthcare in Canada. Last week, we had a discussion about emerging regulation on AI in Canada, and we have 2 more sessions after this, understanding key risks of AI in healthcare, and we'll have a guest presenter from, along with Carol from InfoWay, Janet, who's our Director of Privacy, and March 3rd, we'll have our final webinar, which is my favorite set of topics on governance structures, roles, and responsibilities. These webinars all take place on Thursday from 12 to 1 Eastern time throughout February and through the first day of March. A couple of housekeeping items. This webinar will be recorded. We're asking if you've got questions, if you could put them into the Q&A track. Thank you very much for that. And hopefully you're receiving some of the pre-reads if you've registered a little bit early for these webinars. There will also be simultaneous French translation. You should be able to click the interpretation button and then click French to get the French translation. Nothing is required if you'd like to continue to hear the presentation in English. And many of the topics that we've talked about today and throughout the webinars will have some sort of legal context with them. And I'm just reminding everybody that we're not offering up legal advice. That's something that you can seek out separately as we're moving through. The next slide, please. And without further ado, let me introduce Carol Pio-Vessen. She's been extremely instrumental in helping us develop both the idea of the toolkit and the implementation of the toolkit, and as well as these webinars. And without further ado, let me turn it over to Carol. And thanks a lot, and enjoy yourself. And we'll be back to handle some questions and a few housekeeping things at the end of the session. Bye-bye.
Thank you, Brad, and welcome everybody to the third webinar that unpacks the AI for Implementers toolkit in the health sector. We often talk about the fact that we are on a journey as we go through from idea to implementation and ultimately to monitoring what some of these systems are doing to really support the health sector and advance better patient outcomes. If you have joined us in the prior 2 webinars, you know that what we covered at first instance was really an overview of what does artificial intelligence mean, and in particular, how is it being used in the health sector? And again, I want to just drill down for a second that when we were looking at examples, we're trying as much as possible to look at examples in the health sector. And what we have found is that across the board, coast to coast, our hospitals, our clinics, our clinicians, different healthcare facilities and healthcare providers are starting to use or starting to experiment or in fact creating artificial intelligence. Our health sector, med tech sector is becoming very robust. And we always want to hear of other examples that may be happening in your particular organization. And so if you could contribute some of those examples through InfoWay to Brad, or we will put the email address in the chat, we would really appreciate hearing those examples. We want to capture and we want to showcase what Canadians are doing. It looks like from the poll that we have a really good sort of mix of people that are joining, which is very much what we found in the last two webinars as well. So the first question is, are you currently implementing or thinking of implementing an AI-enabled solution within a healthcare delivery setting? And the audience is split. So it seems that 48% are saying we're not even there yet. Like, we haven't even thought about it. So we're here really to learn. And then the other half, encouragingly, just over the 50% mark, are saying, yes, we're either doing it or we're thinking of it. So that, to that audience in particular, I implore you to contribute whatever experimentation you're doing so we can learn and really start to showcase what Canadians are doing. As to the second question, it asks how much experience you have implementing AI-enabled solutions in the healthcare setting. And interestingly, the vast majority, 76%, say zero, but considering it. So thank you for joining. We hope that this helps you consider, and we certainly hope that it helps you get from the point of sort of exploring concepts to really articulating a strategy for how to do and how to implement some of those ideas. To those who responded that they have more than 3 years of implementing AI, again, or 1 to 3 years of implementing AI, we would love to hear from you, because you've got some experience there that we would love to capture and ultimately reflect. So today's presentation is, I hope, to that 76%, is going to speak to you and give you some tools, as will certainly the March 3rd presentation, but really try to give you some tools of how to start. Starting any project, even in its conceptual form, can be really hard. It's hard to figure out what the first step is. It's hard to figure out who the group needs to be. It's really hard to figure out what problem you're solving and what question you're answering. So today we're going to talk about that. Hi there. Sorry about that. I had my internet fully cut out. Let's pick up from where I left off. So we have a particular audience in mind when we're looking at the different modules. In this particular module, we're actually targeting an audience in the healthcare delivery sector, and in particular, those who are interested or active or looking to become more involved in the innovation of the organization. So in some cases, in the prior two in particular modules, what we found is that the target audience was very broad. Anyone interested, this is what the module is targeting. In this case, we have a little bit more target. So I want you to have that in mind as you're listening to the sort of strategy associated with some of the concepts and the ideas presented here. So this is the target audience at a high level, though of course all are welcome. When you're thinking about where to start, a point I really want to emphasize and drive home is that the process of applying a broader and more ambitious data project within a healthcare institution in particular is about people, values, and culture within the organization. So no matter what, to all those IT professionals who are joining us today, or the CIOs or members of the CIO team, this is not, when we're talking about such a transformative and arguably disruptive technology, it's not just about the technology or the use case, but it is very much about the broader values and culture associated with the organization. And so I want you to build this in even at the early stages of your sort of ideation of potential use cases, because the change management component associated with taking on a big digital or even a smaller digital transformation project is not something that can be ignored. In the toolkit, there's one module that focuses on change management that we're not doing a webinar on it per se, but we're integrating those ideas throughout the 5 webinars, the webinar series. But I do want to emphasize that in this particular context, because when you think about where to start, you really do have to start with, okay, what is the culture of our organization? Who are we as an organization? And where are we going? Who do we want to be? So we say, start by assessing your organization's AI ambitions. But I want to stop on that for a minute, because at no point are we saying that artificial intelligence ought to be implemented for AI's sake, if you will. The idea is that, and there's a great quote in one of the modules, in this particular module actually, there's a great quote that I like that says, you're looking at a system, you're looking at a series of technologies that will augment what you already have. That's great. So what you're trying to do as you design and think through what your ambitions look like, you're really trying to think about where are our strengths, and then where are there areas where we don't necessarily need to be spending our time. It's not the highest value use of our time. And so we could potentially use a technology to facilitate some of that work so that we free our time to achieve our other ambitions or to give more time to our patients. So we start by really looking at what are some of those organizational AI or data ambitions. Who are you as an organization? What do you want to be doing? And then ultimately you build a strategy around what do you need to get there. The second point that we often talk about is assessing viable opportunities for AI experimentation. If you joined us in the first two webinars, you'll note that we talked a bit about the inherent distrust or insecurity or sort of mythology around artificial intelligence, particularly in a highly regulated sector like the health sector. And so often when we're looking at how do we assess the viability of opportunities, we are trying to identify what would make sense from an early stage initiative, and what does success look like, and how will we communicate that? Then finally, we talk about assessing the organization's implementation plan. We're going to take each of these in turn now. So when looking at the organization's AI ambitions, oops. There we go. When looking at some of the organization's AI ambitions, we're specifically trying to identify who the organization is in its threshold as in terms of adopting technologies. So we've defined sort of 4 groupings, if you will, or categories, but these aren't necessarily set in stone. They're just recommended or proposed as potential categories for what the appetite for risk is associated with new technologies. And so the first instance, we identify the innovator. So this is the organization that is happy to be the first. It has a higher risk tolerance. It's very, tech driven. It's interested in using more sophisticated technologies. And so the sort of strategy you build around the innovator's ambitions is going to be very different than the strategy you build around the late adopter, for instance. The early adopter is that organization who is happy to get out there and try out new technologies without it necessarily being perfectly tried, tested, and true. This is especially in the case where you're sort of procuring an AI system. In the event that you're actually building that system yourself, this is an organization that is excited to experiment. It will create that safe infrastructure to experiment, and then, we'll roll out the results of that experimentation. The majority adopter and late adopters are the more cautious type. So these are organizations that don't necessarily need to be first out the gate. They don't necessarily need to be the early adopters. They would prefer to sort of wait and see how something has matured, if it's got good results, how others are doing, and then it will bring on the technology to serve its purposes, assuming that that really fits the overall agenda. And so depending on who you are, depending on the risk appetite of your organization, if you're the leader of the AI strategy within your organization, you will really want to be mindful about how you build the sort of strategic components to match the or work with the culture of your organization, the risk appetite of your organization, maybe push it a little bit to get it to maybe take on something that's slightly less comfortable with. But you're not going to, if you're a late adopter, you're not going to come out with an innovator's strategy. It's just not going to work. You're not going to get the buy-in. And that change management component I started with is going to be very, very tense. So there will be so much friction, or you're at risk of having so much friction, that the program fails even if the results are successful. So just something to bear in mind in deciding who are you as an organization, and then what type of strategy are you going to put in place? How are you going to onboard new technologies to match and feed those ambitions, regardless of what your actual risk appetite looks like? When we talk about viable opportunities for experimentation, we have broken down sort of 3 categories, not to say that these are the only 3 categories that exist. So we would love to hear from you about any other questions, guiding questions, or categories that you would love to see in a comprehensive AI strategy, or that you yourself have built into your own AI strategy. But for present purposes, we say when looking for those viable opportunities for experimentation, consider at least this. So consider the business value. Go back to the point I made a few minutes ago, which was, where is the high value use of my time? And what is it that I don't need to be doing, or wish I didn't have to do, but I do have to do because it's just baked into our process. So when you find those areas that I always call that pain point, the thing I don't want to do, but I have to do, just take a look. It's finding opportunities for experimentation really means unpacking what is the pain point there, and whether there's an element or the entirety of it that could potentially be replaced with a more sophisticated technology, whether it strictly fits the definition of artificial intelligence, which, if you joined us in the first module, you will appreciate has a very broad definition, and it is very much an umbrella term. Is not entirely the point. The point really is, where are there repetitive tasks, mundane tasks? There is potentially a large opportunity cost, or an actual cost associated with those tasks. Where there is opportunity to align value add activities with stakeholder expectations, and then also really trying to think about ways that as medical professionals and healthcare professionals, technology is able to support and augment the value added judgment and skill that you bring, as opposed to the more potentially administrative tasks that might not be your favorite thing to do, but they have to get done and potentially could be replaced by a system. So that's the business value. And I want to just pause on this for 1 second to say, if you joined us last time, we were looking a little bit at this very effervescent regulatory environment in privacy and in the regulation of artificial intelligence. And one thing that is popping up, even since actually last webinar, which was last week, we've seen more and more activity, more being published in the sphere of what does responsible AI from a sort of regulatory diligence perspective look like, or could look like. And this concept of cost benefit, so what is the business value versus what are some of the risks, is embedded in every model or framework that I see. So it doesn't negate, it doesn't say, well, if there's a benefit, then the risks are fine, they're worth it. But it really does drive home the point, particularly in healthcare, that we're looking at this relationship between what is the benefit, the social good that some of these systems can bring, and then how do we assess the costs? How do we assess the risks as against those? What do we do to mitigate those risks? So level of AI readiness is the second category that we unpack. This is super important. If you've heard me talk about this before, you hear me get very passionate about this particular area, because it does touch on that point, that earlier point about change management that we often overlook. So the component around digital literacy is something that is coming up time and again in every organization, particularly in the health sector, that is operationalizing any type of sophisticated AI agenda. Okay, I use those words specifically because the concept of the AI agenda what is intentionally broad because it changes from organization to organization, what it looks internally. That level of readiness will facilitate or hinder your ability to execute on that agenda. So, for example, I'm right now working with a client. In the US, a healthcare organization, really a big, sort of multifaceted healthcare organization that wants to roll out a substantial AI governance program. Interestingly, because of the great work of InfoWay, we're able to point to some of these examples and some of these guides to say, well, look what Canada's doing. We're actually, doing quite a bit in this space. But what I found so interesting throughout this engagement is that the concept, the issue that keeps coming up time and again is not about how much are we spending on technology or what are the results necessarily of the technology. It's about digital literacy. Our people are not sufficiently aware or comfortable with the use of technology. We need more training and more education in order to effectively roll out our plans. It's about digital literacy. So the idea around level of AI readiness is worth spending time on as a starting point. If you're in that 76% of the population of today's audience that said, haven't thought of it and haven't done anything yet, but I'm considering it, I want you to start here. Just understand who is your organization? What is their level of comfort? What is their level of readiness? What type of training do they need to help move the dial and get them closer and closer to a place where they're willing to experiment? Ultimately, there will be, and we're going to explore this on March 3rd, policies and governance structures that are needed to augment what you already have in your privacy management program and your data governance program, but that aligns specifically to responsible and ethical AI principles. So this is, for example, and again, we'll look at this on March 3rd, but issues around, what does our explainability criteria look like? What does our data assessment, data verification, data provenance program look like? What are we actually doing in this space? We're going to have specific requirements around transparency. How does the organization talk about the work that it's doing in artificial intelligence? What type of openness is there to discussing the nature of the technology that's being either developed or purchased? And then how does that relationship with stakeholders look? Finally, the third category is around operational impact. So here you're really, bringing it down a little bit more. If you're in that 76%, you may not be here yet, but start to unpack, do we have internal talent to build these systems, or are we really looking for external support? If you're a smaller regional healthcare authority or facility, then in all likelihood, you're not going to be building these systems in-house. It requires quite a bit of talent in the sort of AI engineering space. And if you don't already have it, you're probably not building it in-house. You're probably going to procure systems and then integrate them into your existing tech stack. In which case there's an entire vendor management program that you want to put in place to assess the risk associated with those particular vendors. But we'll talk about that later. So continuing to move through, how do we implement our AI plans? And so we have proposed this sort of high level strategic planning structure. Again, this is suggestive, it's illustrative, it is not exhaustive or determinative. So it's really here to help you think about where to start. So this does very much speak to, in large part, that 76% of the audience who are really starting to come to and get excited, hopefully, by all the potential that artificial intelligence can bring when executed responsibly. To break down this schematic, I've sort of highlighted a few bullets. So in sort of logical order, it goes organize, identify, prepare, pilot, measure, engage, report. And the reason for this, when I say organize, you'll see at the top, you want to form your strategic planning committee. You want to have a multidisciplinary team. So let me pause on that for 1 second. The team who comes together to help formulate what the overarching governance structure will look like, or what the implementation sort of execution of the AI ambitions will look like, or data ambitions. That team can't just be technologists. It has to include other elements. It should include stakeholders such as clinicians, other healthcare professionals. Legal risk compliance should be at that table. You'll want some potentially patient advocacy or patient stakeholder group to help consult on some of the ideas that might be within or outside the organization. So you really want to think about who is in our organization and who has a role to play in ensuring that what we're producing is not harmful. And when we look at harm, we're thinking through some of those big ethics ideas. Is it going to impact vulnerable populations in a disproportionately negative way, or in any negative way? And we need to understand what the proportion of that negativity is. So are we touching vulnerable populations? If so, do they have a voice? Are they contributing to the design of some of these materials or some of these plans or these systems? Is there a potential harm to individuals across the board? What does that harm potentially look like? Is it physical? Could it be emotional? Is there a potential harm to our environment or to our physical assets? If so, what could that potentially look like? In the first module, we looked at Pepper, the robot who goes around and delivers, or actually Pepper was the one who was greeting people as they walked in. Then we had medical robots who were delivering different items throughout the hospital. Could that robot potentially have an impact on some type of physical space, and have we really thought about what that looks like? Not the best example, but you get what I mean. So we need that multidisciplinary team to start with some of that strategic planning. And when we're talking about strategic planning, we're talking about what does the experimentation rubric look like, and what are the governance infrastructure, what is the governance infrastructure needed to support that experimentation plan. So that's where we start, where we talk about strategic planning. Then we sort of drill down into what are the appropriate use cases. And the appropriate use cases will be very tailored to your organization. What constitutes appropriate and why? What does that look like? Once you've identified a handful of use cases that could be interesting, the next is really to prep and identify risk. So when we're looking at risk, we're talking not only about data-related risks in particular, but then AI system-related risks as well. And the more, now that the elephant's in the room, when you talk about it, AI risks, now then when you go out to the world and Google it, you'll see there's a ton out there that's related to AI risk planning, including what we're going to cover to an extent on March 3rd. So please do look at all of that evolving guidance around AI risk assessments in particular, and AI impact assessments. The next is then to actually do it. So put together your pilot it in a manner that works for your organization, and then report on it. So the step between pilot and I've got we've included a little part here on vendor involvement, again, because the assumption is if you don't have the capacity in-house, you will engage a vendor to support you in developing or deploying the system. So we've got that as a particular consideration. And then there's drawing up what your KPIs, your key performance indicators, will look like, and making sure that you're able to report on that. Because here's the other really important thing related to the change management piece is you have to show success. So it's not enough to just talk about how artificial intelligence could potentially increase efficiencies within our institution and improve better patient or provide better patient outcomes. It's not enough to say that. We actually we have to show how our pilot has contributed to those two goals, or to one of the two goals. And that will start to generate and will perpetuate a feeling of trust with the plan, a trust with the technology, trust with the process that was designed, and then ideally further investment so you can continue to experiment and explore. So those, the next phase, actually, that's right. When we talk about the implementation of the AI plans, it's again going to this point of the multidisciplinary team. And I think we've covered that, but it's really, I do want to drive home the point because it feels very easy to talk to ourselves. So for me, as a lawyer, I always like talking. It makes sense to talk to other lawyers. They know what I'm saying. They understand the principles I'm relying upon. But that's not going to be good enough. So we do need to bring people together to start talking to each other. It's really the only way that we can have a comprehensive and a holistic perspective and strategy, as opposed to a fractured and segmented, that ultimately will just be much more frustrating. Identifying the specific use case, data inventory to set up for success. This part is super key, because when we're talking about that data inventory, we're really saying AI is all about the data. Like the processing of that happens in sort of the magic of the AI system is incredibly important, of course, and the outputs of that are extremely important. But fundamentally, you have to understand your data and you have to get that analysis right. Because what we don't want is for that historic data to be used where it may be incomplete or there may be serious errors in the data. And then it ultimately runs through the system, if you will. The output is problematic, but it's difficult on the outside when you're receiving that output of the system, the decision or the prediction or the recommendation. It's really difficult at that point to understand and assess the strength of that output. You often, on the receiving end, depending on who that person is, you will often just rely on the fact that due diligence was undertaken in the early stages so that the output is in fact valuable and reliable. Obviously, there's also testing on the output. We're not saying that you just trust whatever comes out, never. But having that entire life cycle put under a certain degree of scrutiny and diligence is extremely important and is becoming a regulatory requirement. I can anticipate that in the next 5 to 7 years. Go ahead, pilot those projects, document your lessons learned, document your success. I wanted to close with a particular example. I love this example. So first of all, the example is out of Newfoundland and Labrador with Eastern Health. And I love this example because I had the opportunity to interview one of the primary leads of this particular initiative and to hear her talk us through everything from how it started to how it's going was really fascinating. So this was an initiative, it was an employee virtual assistant that was created. And the idea was that it would leverage AI to improve the employee knowledge of what mental health resources were available. This actually started before COVID, and it proved to be a very successful use case throughout, and it's continuing today. So the initiative was to develop a chatbot that would assist with triaging and navigating the various resources available to employees that are related to mental health, to really support employees within the Eastern Health system with whatever supports they need, including to have an effective peer referral program and peer support program. The investment was initially contemplated to be relatively contained. And something that was very interesting coming out of this interview was that the interviewee was surprised in the end with the overall sort of involvement. So meaning the overall amount of time it took and related costs. And the reason I raise this is not to raise a negative, but simply to say it's when you're looking at certain experimentation and you're looking particularly when you need to rely on an external stakeholder or an external vendor, you really do need to understand what it takes to build a successful system so that you can foresee to an extent what the related costs will look like. So that's really important. And especially where you don't necessarily have the talent in-house to manage these more sophisticated systems. But the result has been extremely positive. So the number of employees accessing the mental health tool, as you can see here, increased. It actually peaked at around 800 users and then eventually has normalized to about 200 users per month, which is actually really impressive. Not to mention the system is becoming smarter and better at triaging and providing support and indicating to the users how to receive the type of support that they need. From a sort of stakeholder engagement perspective and from a lessons learned perspective, the findings were that it was really helpful to have frontline workers be involved in the process. This was very much an internally driven process where within the health authority, there was an identification of a pain point. People didn't know where to go to get mental health supports. This identification, led to a degree of exploration. Well, what do we have available? Who could potentially help us? What would that help look like? So it really, you sort of follow the journey of this provider, and you see that exactly what we're talking about is what they implemented. There had to be a degree of socialization so people could become comfortable interacting with this chatbot. At first, so I loved this story. So at first, they just couldn't get people to use the chatbot. And then finally, they ran a challenge and said, okay, well, if you use the chatbot in a certain capacity, then you could potentially win an iPad. And all of a sudden, you get this peak of over 800 users that are accessing EVA. So thinking through that change management and that sort of digital literacy, social engagement piece is, as I said, super important. And it certainly proved to be the case here. Other lessons learned is that the use of AI can't be isolated from other social challenges that it has been designed to address. So you need to undertake that impact assessment and think through the various implications of your AI system. But at this early stage that we're covering in this particular module, I think when you think through who is my organization, what are we already doing, who are our key stakeholders, what do we want to do? Do we have the resources to do it? Those are some of those key questions you're going to ask just to get started. So that's for all of you who are in the 76%. And then, I love this, that the AI initiative is patient and human-centric. So this is not AI for AI's sake. This is identifying a specific need that fills a human value, a human need, in fact, an Eastern health need, and it's supporting that. That helped also facilitate with senior management buy-in. You're going to need the resources, you're going to need the time. If you want senior management to buy in, or if you want your colleagues in the senior management team to buy in, then you've got to give them the reasons to do so. So a great example, you can read more about it in the module and in the toolkit across the board. With that, I will open it up for questions. Again, apologizing for my computer cutting out, my internet cutting out.
Well, apology accepted, Carol. We'll let you off this time. as we're doing it. So we do have a couple of questions. I wanted to follow up on that last slide about Eastern Health. And I know when we were talking with that group, one of the things we thought about was, geez, this is not purely a clinical application. And maybe this is a nice way to start with something that's got more of an administrative feel to it. And can you just expand on that a little bit? Is this a good way to begin to get your sea legs with AI implementations?
Absolutely. So okay, great point, Brad, because if you go back to the different categories, let's say you're a late adopter, right? You've done the assessment of your organization and you recognize that you're a late adopter. Then trying to start with a clinical use case is probably going to be a bit challenging, right? It's got higher risk. It has a direct impact on patients. There's less digital literacy when you're talking about patients and clinicians necessarily using these AI systems as opposed to engineers being the output. So there are a number of risk factors that arguably will not work as well with a late adopter. However, when you're talking about an internal administrative function, it is arguable that, and in fact, in this case, I don't know if Eastern Health is considered a late adopter. I didn't ask, but you can see how it becomes a little bit easier to sell. So here's our use case. Our use case is we're solving a direct pain point that's going to help our people. It's fairly contained. So it's not a chatbot that gives you advice on your employment rights. It's very contained. It's on an important topic. So there is a risk component there. We have to be mindful, but it's on an important topic that we're not able to manage internally well. It's not, so far, we have not been effectively doing something, or it's not the best use of the time because we keep getting the same questions over and over and over again. There's got to be a more effective way to do this. So really successful in identifying that pain point, that problem, that starting point. But the other thing that I think is so successful about Eva, and that's the reason I loved speaking to the interview about this, is that it wasn't a success right at the beginning. It was slow to grow at first. And it wasn't until they sat back and said, well, wait a second, we're not going to let this be our failure. We're going to figure out what is it? How do we get our stakeholders, particularly the end users, more excited or interested in just exploring? As I'm starting to think about it more and more, it was, the effort was to sort of map out and really navigate. You had to find certain things within the app as you navigated through it. So it forced you to use the app, and it was a bit of gamification of use. That's clever. And that really does require a degree of thought, and for the organization to sort of step back and take responsibility for it and say, well, how are we going to turn this into a success? Which they did. So it's a great use case. I really love it.
Okay. Well, that makes sense to me. In the chat, Neiman's got an interesting kind of comment question, and it's about, I've read it a few times. I think I got a handle on it. What he said is that AI solutions may not stand by themselves. There could be a lot of work from a workflow perspective that happens at the front, maybe some from at the end. It's not all about AI all the time. And I think in particular, when it comes down to thinking about enterprise roles AI has, there's going to be analog, old school ways of feeding AI, and maybe there's going to be some, assisted decision-making coming out the other end. And maybe you can comment on that.
I think it's a great point, because we sort of use messy language, or I shouldn't say we, maybe it's just my fault. Like, I use messy language when referring to the systems, or frankly, when referring to AI. So, and part of this is because it's from a policy perspective in particular, so not even legal or regulatory, although that's next on its heels. It's still very broadly defined. And the parameters that are being put around what constitutes AI, or what elements of AI ought to be regulated, or is it system-wide? Is it one component? So in the context of Pepper or the delivery robot, you've got hardware with software that's smart software that's built in. So the language, my language has not been extremely neat, but it is what I'm seeing reflected in much of the policy discussion. I think that language becomes more and more important as we get to sort of lawmaking, because we're going to need to be clearer about what we're regulating. In the policy context, it allows us to an extent to just an opportunity to discuss and debate. But I'd love to hear more, actually.
I think it's a really interesting question about maturity and how solutions fit, and this whole end-to-end view.
It's a great point.
Yeah, it's a great point. One of the other things that showed up in one of your earlier slides is you talked about organizations, entities, artificial intelligence ambitions. But I also wonder, to what extent is there also a proxy with their data ambitions, and how much time have they spent on their data and managing their data, and how that might lead into an AI ambitions review as well?
Absolutely. So let's be really clear about one point. It is all about the data. Okay. So for that, the 76% in particular of our audience who, is very, very, very early into this process, one of the first things you will need to wrap your head around is, what data do we have? What authorities do we have over using that data? I mean, the list of questions is actually quite extensive, but basically where you're getting to is, can we use it? Is it good quality? What are we using it for? What are some of the other considerations we need to have in mind? Are we mixing it with other data sets? And then you can start to have a meaningful discussion about, well, what is the world of possibility here? So it really is all about the data. And I agree with you that you could, in essence, replace AI ambitions with data ambitions, right? Because at the end of your AI ambitions is actually sort of, it's, from my perspective, it's very much more about the output. It's about the process and output, as opposed to your data ambitions, which are, I think, broader, right? So you can be doing, your data ambitions can be ultimately divorced from the concept of AI, because you could be just looking at great data governance, whereas the AI ambitions are really, well, what are we going to do with this data? How are we going to use it for better patient outcomes and more efficient systems? But I agree with you that they are complementary, and arguably you could replace one from the other. Data could replace AI. AI can't replace data.
Right. Well, that's kind of, I think that's something to think about. And most healthcare groups are going through some sort of conversation about data. Last week, we talked about some of the AI regulations and where it overlapped with some of the privacy regulations in the country. Next week, we're going to be talking about the risks. And once we enter into the AI or to the data conversation, there's a lot of other places to hang on to for healthcare groups. So we're going to talk about risks next week. But I wonder, in the context of getting ready or thinking about whether your organization is ready, are there any showstoppers, where you'd want to push a red button, or, proceed with caution? What would be the one or two things that you might want to say you should really take a deeper look into this if you begin to think about this within your organization?
I mean, that's in a little bit of a tough question to answer, because it depends on the data. Again, it depends on if there's a showstopper in your data, it's a showstopper, right? You need to rectify that before you go anywhere. If you don't have any internal capacity, particularly any technical or, I guess, technical capacity at all within your organization, then you're going to need to build that capacity before you engage a vendor, because you're not going to know what questions you need to ask, or you're not going to know how to assess risk appropriately. So there are circumstances where I wouldn't say it's like a full showstopper where you cannot proceed. It's just there's major work that needs to be done before you get going. So if you don't have any data governance plan in place or any privacy management program in place, then you're going to be starting there. You need to first figure out, you've got a lot of PHI, that personal health information, and you need to figure out, are we able to use this for anything? Or what do we need to do to be able to use this at all? So that becomes a very important, but could be quite a big exercise.
Okay, that's great, Carol. Thanks a lot. Why don't we move to the next slide, and we'll just wrap up here. So I wanted to thank everyone for attending our third webinar. As I mentioned, this is the third of 5. Next one is really going to dig into some of these risks that Carol began to hint at, and it's a real topic of conversation. Lots of insight, experience, opinions in this, and we're going to really put a real AI flavor on top of it. So I think that's going to be quite interesting. Again, the link and the QR code for our toolkit download. You've got some email information from us. We're really looking for more success stories. If you want to reach out to us, just send us a note. That would be great. We'll be having a post-webinar survey, so please fill that out. It's actually quite useful for us to try to tune this going forward. I hope to see all of you and many of your friends next Thursday at this time from 12 to 1, and we'll go into the 4th webinar on Module 2 of the Toolkit. And Carol, thanks a lot again. Really interesting, and everybody have a great day. Bye-bye.
Thank you. Take care.